Periodontal probing. Each tooth has 6 zones. You will take the deepest reading from each zone to record on your perio chart. Zone 1 is distal buccal, Zone 2 is straight buccal, Zone 3 is mesial buccal, Zone 4 is distal lingual, Zone 5 is straight lingual, and Zone 6 is mesial lingual. Starting at the line angle, insert the tip of the probe subgingivally. Use gentle bobbing or walking strokes 1 millimeter in length until you hit the contact and cannot walk the probe any further. Tilt the probe slightly, about 10 degrees, and angle into the caul. You will feel resistance when you're at the base of the pocket. When performing walking or bobbing strokes, keep the probe tip subgingival. Do not come out of the sulcus. Be sure to always keep the probe parallel with the long axis of the tooth and adapt the probe tip to the tooth. This view demonstrates the proper angle for tip to tooth and keeping the probe parallel to the long axis of the tooth. Again, using gentle 1 millimeter walking or bobbing strokes, staying in the sulcus, covering the whole circumference of the tooth, and angling into the caul. With correct probing technique, you will see the tissue blanch as seen here. Start probing quad 1 distal buccal zone of the terminal molar to follow the correct probing sequence. Continue distal to mesial on each tooth. Use all criteria for proper grasp and follow clock positions. Insert the tip of the probe subgingivally. Use gentle bobbing or walking strokes 1 millimeter in length until you hit the contact and cannot walk the probe any further. Tilt the probe slightly, about 10 degrees, and angle into the caul. You will feel resistance when you're at the base of the pockets. Note the probe handle is in line with the occlusal plane and the clinician has an extraoral fulcrum for the maxillary molars. You may use an intraoral fulcrum for probing maxillary premolars. Probing maxillary anterior teeth, you may choose to sit at the 8 to 9 o'clock position or the 12 o'clock position using an intraoral fulcrum. You should be constantly pivoting on your fulcrum to keep the probe tip adapted to the tooth surface. Quadrant 2 buccal aspect, intraoral fulcrum for maxillary premolars, and probe handle is in line with the occlusal plane. Lingual aspect of quadrant 2, you will have to use indirect vision to obtain the distal reading on the terminal molar. Sitting at the 12 o'clock position, use indirect vision to probe the linguals of the maxillary anterior teeth. Lingual aspect of quadrant 1, you will need to use indirect vision and keep your probe handle in line with the occlusal plane. Once maxillary arch is completed, move to the buccal of quadrant 4. Use intraoral fulcrums for all mandibular teeth. Note the probe is parallel with the tooth and the clinician stays in the sulcus while using walking strokes. The probe handle is in line with the occlusal plane. Sit at the 8 to 9 o'clock or 12 o'clock position for mandibular anterior teeth. Note as you cross the midline, you are now probing mesial to distal to keep the correct probing sequence. Quadrant 3, buccal aspect. Quadrant 3, lingual aspect. Again, you will need to use indirect vision for linguals of anterior teeth. As you cross the midline, you will now be probing mesial to distal. Quadrant 4, lingual aspect. Here's what a periodontal chart looks like. Note pocket depths of 1 to 3 millimeters are in black. Pocket depths 4 millimeters and above are in red.